7 symptoms of a heart attack 1 month before. Did you know that every 40 seconds, someone in the United States has a heart attack? Over the past decade, there has been a noticeable increase in heart attacks, particularly among individuals under 40 years old and women. Surprisingly, 1 in 5 women is at risk of having a heart attack. According to international health authorities, cardiovascular diseases are responsible for over 17 million deaths annually. That's more than 30 individuals every minute, surpassing the fatalities from cancer and traffic accidents combined. The insidious nature of these diseases lies in their silence. Often, we only become aware of the danger when it is too late. This happens mainly because the critical early warning signs that precede a heart attack are not widely known. Today, we will discuss the reasons behind the increase in heart attack cases. We will delve into why this alarming trend is affecting younger populations, including men and women, and even those who previously showed no signs of heart problems. Frequently, heart attacks occur when we least expect them, underscoring the need for awareness and preventive measures. Let's uncover the 7 signs that your body might display a month, or just days, before a heart attack. Stay with us until the end of this video, as I will also reveal the factors contributing to the alarming increase in heart attacks among individuals under 40 years old. If you recognize any of these 7 symptoms, you could be just days away from a heart attack. It is crucial to consult a cardiologist immediately, as any delay could lead to irreversible damage to the heart. Let's begin with the first symptom of a heart attack 1 month before. Symptom number 1. Cold sweat and pallor. In fact, up to 30% of individuals who had a heart attack reported experiencing this in the days leading up to the event. But what differentiates this from normal sweating? When experiencing cold sweat related to heart problems, it appears suddenly and is markedly different from the sweat produced when you are hot or engaged in physical activity. It is sticky and cold, often accompanied by a chill on the forehead or body, and you may notice a sudden paleness in your skin. This symptom can come and go, resolving spontaneously within a few minutes, and can occur at any time, while at rest, eating, or during any routine activity. Additionally, it tends to happen repeatedly before a heart attack occurs. If you notice this type of cold sweat and pallor, especially if it happens multiple times, it is crucial to take it seriously. These are not ordinary symptoms, they could be indicating that your heart is in distress. Seeking medical attention promptly can be vital to preventing a heart attack. Symptom number 2. Fatigue or shortness of breath. This symptom is critical. An impressive 70% of women who experienced a heart attack reported feeling fatigue or shortness of breath in the days or even hours leading up to the event. This is not common tiredness. It is similar to flu fatigue, but without the associated cough, fever, or sore throat. Such profound weakness or muscle fatigue, especially if it is a new development in the last 30 days, deserves your attention. Pay special attention if you suddenly find yourself short of breath after light activities, such as walking a block or climbing stairs, or if you are experiencing an unusual level of exhaustion disproportionate to your effort. These signs can indicate clogged arteries, a precursor to a heart attack, even if you do not feel any chest pain. Determining if your shortness of breath or fatigue is a heart issue or something else, like anemia, bronchitis, or simply lack of physical activity, can be perplexing. There are 2 critical indicators that suggest your symptoms might be heart-related. A recent and noticeable increase in symptoms, especially if they are new or have worsened recently, and the presence of risk factors for heart disease. The combination of symptoms and your personal health history paints the complete picture. Symptom 3. Jaw pain. This requires your careful attention. Just as tingling in the leg can indicate spinal issues or shoulder pain can be linked to the gallbladder or liver, jaw pain, particularly on the left side, can signal a heart problem, possibly warning of an imminent heart attack. This phenomenon is due to how our bodies are wired. As we develop in the womb, our organs form with nerves that originate from other parts of the body. As a result, when we are adults, our brain can sometimes get confused about the origin of the pain. Therefore, if you experience unusual or persistent jaw pain, especially on the left side, consider it a potential warning sign. It's not just about where the pain is, but understanding that sometimes pain in one area can indicate a serious problem elsewhere. Remember, while jaw pain can have many causes, if it is accompanied by other heart attack symptoms or if you have risk factors, do not underestimate it. It is always better to be cautious and seek a cardiologist urgently, especially if it is accompanied by other signs that I will tell you. Symptom 4. Digestive discomfort. This symptom is particularly prevalent among women and the elderly. It is not just any stomach ache, it is pain that can mimic gastritis, but it is not. You might notice stomach bloating during or after meals, or even pain while walking or exerting yourself. These are the moments when it is crucial to consider that the root cause might be your heart, not your stomach, especially if you fall into the high-risk categories for atherosclerosis, being over 50, although it can occur at any age, having diabetes, high blood pressure, obesity, especially excess visceral fat, smoking, or being regularly exposed to secondhand smoke. If this resonates with your experiences, especially if you have the mentioned risk factors, I urge you not to dismiss these signs. They could be the early warning your body is giving about an impending heart attack. Early detection can be key to saving your heart and potentially your life. Do not underestimate these symptoms. Symptom 5. Back pain. Pain around the shoulder blade or lower neck, especially on the left side, can be a precursor to a heart attack or indicate a problem with the aorta, one of the largest arteries in our body. It is easy to dismiss this as mere muscle pain, but here you need to be cautious. If the pain does not improve with changes in position or self-massage, it could be signaling something more serious. Unlike typical muscle pain, this type of pain is persistent and does not respond to usual remedies. The aorta is responsible for supplying blood to almost all parts of the body. Conditions that weaken its wall can lead to ulcer formation or tears, resulting in very intense pain between the shoulder blades. Aortic problems are medical emergencies and require immediate attention. If you are experiencing this type of back pain, particularly if it is a new symptom and does not respond to typical treatments, it is crucial to consider the possibility of a heart or aortic problem. The nature of the pain associated with heart or aortic issues is distinct and severe. In the case of aortic problems, the pain is intense, feeling like something is piercing you from the front of the chest to the back. However, when the pain is related to a possible heart attack, it tends to be milder but still significant, more like a persistent pressure in the back. It is not constant, instead, it comes and goes, usually lasting only a few minutes at a time. If you are experiencing this type of pressure-like back pain, do not dismiss new or unusual back pain. It could be your body alerting you to a serious condition. Symptom 6. Numbness in the left hand and arm. In the last month, have you been experiencing slight pain or numbness in your left arm and hand, especially during activities like walking or climbing stairs? If so, take this as a potential warning sign. While it is true that various health issues can cause this numbness, it is crucial to consider the context. If this symptom is new to you, if you have the risk factors for heart disease mentioned earlier, and if there is no other logical explanation for this sudden change, then it is time to act. If you are at risk of heart problems, consulting a cardiologist can be a vital step. Symptom 7. Dizziness. Be wary of sudden dizziness, a feeling of faintness, or episodes of low blood pressure that arise out of nowhere. These symptoms, especially if they started recently and occur during physical exertion like walking a block, climbing stairs, or even while eating, should not be ignored. Many patients who experience these symptoms and are later diagnosed with significant heart problems undergo cardiac catheterization, a diagnostic procedure that involves the administration of contrast to visualize the coronary arteries, often revealing that the blockage is nearly complete. Why do heart attacks occur? It all starts with the vital role of the heart, pumping nutrient and oxygen-rich blood throughout the body, including to the heart muscle itself. The coronary arteries, nestled in the walls of the heart, are tasked with delivering this blood directly to the heart. A heart attack, also known as acute coronary syndrome, happens when these crucial arteries become blocked. This blockage can arise from various factors, including cholesterol buildup, calcium deposits, and inflammation in the artery walls, all of which impede the free flow of blood. The main culprit behind these blockages is often atherosclerosis, a condition where the arteries harden and narrow. What makes atherosclerosis dangerous is its silent nature, often presenting no symptoms until it is too late. Atherosclerosis is like a plaque of cholesterol and inflammation slowly growing inside your artery. Over the years, this plaque can gradually obstruct blood flow, potentially leading to heart attacks or sudden death if untreated. Heart attacks can occur due to partial obstructions of the arteries as well, where inflamed plaque ruptures, leading to a clot that suddenly blocks blood flow, causing a heart attack. Before a major heart attack, you might notice pre-heart attack symptoms, due to the temporary lack of blood and oxygen to the heart, signaling the potential for a more serious event soon. Frequently, these symptoms appear during times of stress or high emotion, such as during a scare, an argument, or intense physical exertion. Poor sleep or any situation that significantly accelerates the heart can also be a trigger. However, remember, these symptoms can arise at any time, day or night. Be alert to any unusual physical changes, especially if they occur during or after the mentioned situations. Recognizing these signs early can save your life. How to distinguish between a pre-heart attack and a real heart attack. When a heart attack occurs, it means that part of the heart muscle has been irreversibly damaged due to the lack of blood supply. Individuals who experience a heart attack report persistent pressure or a sensation of tightness in the chest. This discomfort lasts for a long period, often many minutes, and does not simply disappear. Additionally, a heart attack can bring additional distressing symptoms, such as nausea, vomiting, a general feeling of malaise, shortness of breath, or even an intense sense of impending doom, often accompanied by cold sweat. The critical difference lies in the duration and severity. A pre-heart attack typically lasts only a short period, perhaps 10 to 15 minutes, often improving quickly when the person rests, sits, or takes a vasodilator pill under the tongue. If you have been experiencing any of these symptoms, consider them not just as warnings of possible clogged arteries but also as a reminder that there is still time to act and save your heart. At the first sign of these symptoms, it is imperative to seek medical help immediately. Go to the emergency room, call an ambulance, and inform a family member. Remember, in matters of the heart, every second counts. In the last 15 years, hospitalizations for heart attacks in people under 39 years old have increased by more than 60%, particularly among women, with deaths increasing by more than 10%. This increase is linked to the growing prevalence of atherosclerosis in young people. Modern life, which makes many tasks more convenient, has its downsides. With just a tap on our phones, we can easily order fast food. Heart attacks can be prevented simply by modifying some lifestyle habits. If you smoke, make it a priority to quit. Quitting smoking can reduce your risk of a heart attack by 30%. Keep your blood pressure under control. Are you diabetic? Ensure your blood sugar levels are well managed. Adopt a healthy diet to significantly lower your cardiovascular risk. Limit ultra-processed foods and increase your intake of fruits, vegetables, and whole grains. Reduce sugar consumption and incorporate more olive oil into your meals. Are you dealing with high cholesterol? Seek treatment. Are you dealing with obesity? Prioritize weight loss. Set the chair aside and adopt activity. Additionally, ensure you are getting quality sleep. Aim for 7 to 8 hours per night and, importantly, have regular cardiovascular checkups. Cardiovascular diseases should not even be among the leading causes of death globally, but today they are at the top of the list. Let's all do our part to change this narrative by taking these preventive measures seriously and prioritizing our heart health. Have you or someone you know exhibited any of these symptoms before a heart attack? Leave your comment below. Share this video with your friends and family. You could save a life. If you haven't subscribed yet, subscribe to our channel. Also, turn on notifications so you don't miss our next videos. And which video will you watch next? I leave 2 recommendations here. Your engagement helps us a lot to continue growing. See you in the next video. Bye.